This afternoon, we learned that 3 Ohioans have tested positive for COVID-19. At this point, these individuals are being notified. They have not been notified. Contact has not been made yet. We would anticipate that they would be notified and learn of this any moment, any minute. So we are going to have to hold off describing exactly where they are and the circumstances. But just as soon as they are notified and the appropriate health department notifies us, we will be back to tell you that information. From what we see around the world and in the United States, this disease will, for a period, significantly disrupt our lives. This is certainly no ordinary time. It's important for us to take aggressive action to protect Ohioans. And the actions that we take now will, in fact, save lives. That we are sure of. Let me announce some of the steps that Ohio is taking. First of all, the state is canceling all travel that is not absolutely necessary and essential. Second, I just signed a state of emergency. And again, this really allows us to do some things that we could not do without a state of emergency. For example, it would allow us to purchase items, health-related items, without a bid. The BWC has canceled its annual meeting. That is something that was occurring this week with about 8,000 attendees. The Secretary of State will have more information, I believe, tomorrow on this, but there are approximately 75 voting locations in the state of Ohio that are in a nursing home. Those will have to be moved. We will not have that many people going into the nursing home. We would suggest that people vote early. This is a way. Voting is still open now, of course, and it has been open. People will have the opportunity to go in and vote and avoid a lot of crowds. Secretary of State will also have an announcement in regard to voting in schools. Many schools already, it is segregated from the general public going in and the voting. Some schools actually cancel school that day. But for those schools that don't fall into either one of those categories, then they will have to there'll have to be appropriate action to separate the public that is going in from the students. I'm going to turn this over in a moment to Dr. Acton. But again, we're going to continue to keep the public informed as to what is going on. And in addition to that, you would expect daily information from us. We put together, as I indicated on Saturday, a working group of eminent doctors who are advising us. They continue to advise us every single day in regard to what steps that we should be taking as a state and as a people. Dr. Acton will talk about those groups that are most at risk. Certainly the elderly are most at risk. Again, we would urge people to use common sense. Where possible, avoid crowds, certainly avoid large crowds. Something that's difficult for a politician to do, stop shaking hands. I have stopped doing that. And, wash your hands frequently, use hand sanitizer, etc. There are lessons, I think, that we can learn from previous pandemics and crises like this. I'm actually reading a book now on the influenza of 1918, and they make a distinction between how two cities handle it. St. Louis handled it well, Philadelphia did not. A lot of it had to do with just the openness and candor of the officials. It also had to do with how seriously the problem was being taken care of. So my commitment to the people of Ohio is that we will continue to inform you of exactly what we know in Ohio, what is taking place. This is, as I said, certainly an unusual time. Most Ohioans were not alive when we've had anything similar to this, or certainly many Ohioans were not alive. We have activated, at 1 p.m. today, we activated our Emergency Operations Center. Again, that is expected. We knew we were going to be activating it at some point. It now allows us to better communicate and have everybody in one location. I would again mention the hotline that we have. We received approximately 1,000 calls this weekend. So we encourage people, if they have things that they need to ask, it is 1-833-4, as in the number, ask-ODH. So that's 1-833-4-ASK-ODH. It is those calls are being taken by professionals. These are nurses. These are people who are trained in this particular area. So I'm going to ask Dr. Acton to come back up and just give you some more specific information from the medical point of view. Doctor, come on up.
Thank you. Good afternoon, everybody. So as the governor said, we recently received results from our lab. We can now do the testing here, and we do have 3 cases in Ohio. You will be hearing more very shortly, details about that, but because the actual individuals have not been notified yet, I cannot share more than that. But as we know, you will know very shortly. As the governor said, this is an unprecedented time, and I think, we've been talking about that, but it's really important that all Ohioans know this is unusual. From the very beginning, when we took the steps that we have taken, closing down borders, the kinds of actions that you are seeing in public health, we've known all along that this is our best attempt to slow down the spread of disease, and it matters that we do that, and that's why here in Ohio, we will be taking very aggressive actions. We are leaning in, we've been leaning in all along, and we will be providing guidance to Ohioans in the days to come. If you look at a place like Italy, 2 weeks ago, they had 9 cases. And so we see how quickly, hour by hour, things can change. 95% of the cases they have now happened in the last 10 days. And so as this situation evolves, it's becoming increasingly clear that there is community spread. We're watching. I'm working with my colleagues in each state. We're talking every day. I'm talking to the federal government, to the White House. The governor just had a call for all governors. We're getting the latest information, but we as a state in Ohio are leaning in and taking aggressive approach. I want to tell you a little bit about who is most at risk for this disease. There has been some studies released just this weekend from the World Health Organization. If you remember, they went into China to study this more along with some CDC colleagues. There's also been a little bit of science around South Korea. And so increasingly we're knowing that the older you get, the more at risk you are. Younger people seem to be even less at risk than the flu. but we know that our seniors are most at risk, and those are the groups we're reaching out to now. So people who are hospitalized, people who are elderly. Also at risk are people with chronic diseases, so people with heart disease, lung disease, people who are severely overweight, people who are immunocompromised because they're taking maybe drugs for a cancer. These are the folks that we, in particular, are speeding up the testing on and prioritizing because we know they're most at risk. Our healthcare workers are also at risk, and we're taking unprecedented measures to protect their safety through our partnerships with hospitals, with nursing homes, with long-term care agencies. So we will continue to protect them. For most of us, I want you to continue to come for your guidance because, as I've said all along, the situation changes hourly. And so it is coronavirus.ohio.gov, tips for everyone in the general public, but also for businesses, schools, nursing homes, daycares, preschools, for all sectors of society. And as the governor said, our hotline is open right now. It is 833-4-ASK-ODH. Again, we've learned from history and we've studied pandemics, and I do call this a pandemic because in my mind, it definitely meets the criteria of that when we see this sort of community spread. The actions we take today and in the days to come here in Ohio will make our lives a little more uncomfortable. You'll be hearing guidance on travel, on visiting your loved ones. We don't want you visiting your loved ones in a nursing home if you're sick. If you live with someone who's in one of these high-risk groups, you should treat yourself in a household as a vulnerable household. Don't just think about the one person. One of the things Dr. Fauci just said to me on a phone call was, when you are in a household with someone who is at risk, treat yourself as if you have the disease and take the same precautions. And that's how we can protect our most vulnerable. So much more guidance will be coming, but people do need to know that it won't be life as normal in this country for a while. And we will be leaning in and asking businesses and everyone to cooperate as we give guidelines for what's best for Ohioans. And again, we will come to you with everything as we know it, the second we know it. Thank you.
3 Ohioans have now been notified. All 3 are from Cuyahoga County. All 3 individuals are in their 50s. One couple was on a cruise on the Nile. One of them has been hospitalized, one not. The third person, unrelated to the first 2, went to APAC conference in Washington, D.C. So those are the essential facts that we have at this point.